Assalamualaikum warahmatullahi wabarakatuh. Hi, we are from Group 2, Class A, Public Health Major, Siliwangi University. Let me introduce myself and my partner. I am Alisa, Siti, Hanifah, and my partner is Khumairoh and Tahani, Nisrina, Nadhifah. We will explore Unit 4. Happy watching! First, I will start Unit 4 about symptoms. In the first paragraph, the writer tells us about signs and symptoms are the tools for making a diagnosis, but between the two there are differences. The second paragraph discusses about the signs of an illness are the things that a doctor or nurse can see and measure, like spot and bleeding, while symptoms are the things which a patient experiences but others can always see, for example, dizziness and nausea. The third paragraph discusses about the symptoms which make a patient seek medical help in the first place are called the presenting symptoms. Medics describe them in terms of being either strong, mild, or weak. The symptoms which stay weak for a long time and the illness remains undiagnosed are called non-specific, for example, fatigue. And in the last paragraph, the text tells about the more detail they have from patients, the faster they can make a diagnosis. Next, I will answer task 1 and task 2.
Task 1 about comprehension. State true or false according to the text in the statement. 1. You need signs and symptoms for a diagnosis is true. 2. You can't see symptoms is true. 3. Patients presenting symptoms are either strong, mild, or weak is true. 4. Ocular disease can have weak symptoms is true. 5. Non-specific symptoms help a lot with diagnosis is false. 6. Too much information slows up diagnosis false. Task 2 about vocabulary. A. Can you feel this? 3. Numbness. B. Do you have them on your back too? 2. Spots. C. How was it? 4. Fever. D. When you have an attack, do you feel over? 7. Dizziness. E. Was there any fluidity? 1. Diarrhea. F. Do you still feel sick? 6. Nausea. G. How long has it been this big? 5. Swelling. 30. Vocabulary practice. Correcting words to complete the sentence. 1. I have aches and pains all over my body. 2. My pulse is up to 150 per minute and I feel dizzy. 3. I have got an itchy rash on the back of my hand. 5. My leg is cut and bruised for the accident. 5. He feels nauseous and needs to sit down. 6. He has a small lump or hard breast. 7. Her spine is deformed.
Hi, I'm Tahani. We'll answer task 3 about grammar. Number 1. Who prescribed you that medication? 2. Can you move your fingers? 3. Has he been like this for a long time? 4. Is the swelling going down? 5. You won't try to move, will you? 6. How long have you been waiting for your appointment? 7. The pain is in your arm, isn't it? 8. Could you tell me where it hurts? Hi, I will answer task 4 about keywords. Number 1. She suffered nausea and vomiting. 2. Lump is an external symptom. 3. She had a swollen abdomen. 4. Rash are a typical symptom of chickenpox. 5. A deep cut needs stitches to heal properly. 6. A spot can cause itching. 7. He found a bruising above his ankle. 8. Her extreme mood swings are difficult to live with.
Hi, I'm Khumairoh. I will answer text 5 about speaking and listening. On the first conversation talked about some troubling symptoms. The patient has symptoms such as bad cough but no have a fever, a headache and little bit of diarrhea, and the last few days have had a stuffy head. And then on the second conversation, talked about patients who feel nauseous but do not experience vomiting and diarrhea.
Hi, we will tell our reflection of this unit. I will tell you about what skills we learned from this unit. First, from task 1 about comprehension. From this task, we learn to focus on reading in order to answer the question correctly. Second, from task 2 about vocabulary. We learn to find the meaning of new words and choose it to the correct question. Third, from task 3 about grammar. we learn to choose the correct option to complete the sentence. Fourth, from task 4 about keyword. From this task, we learn to choose the right word to complete the sentence. The last is from task 5 about speaking and listening. From this task, we can upgrade our speaking skill with communicate using English.
Next, I will tell you about what the new thing we get on the topic. Many new things that we got from this topic, that is the new vocabulary in English, and we know the difference between signs and symptoms.
Okay, next read question C. In text 1, compression sentence in reading, whether it's true or false. In text 2, connect the correct vocabulary with the question below, and then practice vocabulary in a sentence. In text 3, about grammar, we choose the correct option to complete the sentence. In text 4, complete the sentence with the word on the list. In text 5, conversation between doctors and patient about symptoms, and conversation between nurse and patient who are nurses. Okay, that's all we can say. Thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.